Aris was founded back in 2007 behind Summa Health System, who was the driving factor of our company. Hybrid radiology was something that Aris developed. We originally started off as a teleradiology company, and we saw a need in the marketplace for a model that would deliver subspecialty reads in conjunction with the radiologist on site. We want to partner with our hospital clients to not only improve the quality of their radiology reads, but to make a big impact in patient care.
We at Aris see hybrid as the next natural step in professional radiology. Hybrid solution is really a unique blend of on and off-site professional radiology services built on a foundation of quality and delivered through integration of the latest IT platform available in the marketplace. The Aris Hybrid solution deploys a single cohesive group of radiologists. There's not a daytime group and a nighttime service, but one single cohesive unit that is available via one phone number any time of the day or night.
Quality is the main piece that we focused on from the beginning of the company and maintains really the cornerstone of the company today.
We are absolutely passionate about quality. We measure it and track it daily by client and by study category. We report it monthly.
We developed a quality assurance program that's headed up by our Chief Medical Officer, Dr. Malay Modi. And this program essentially measures the quality of all our radiologists, and that information, it becomes a circular, if you will, continuous feedback loop for our radiologists so that they can become better radiologists in practicing their profession in radiology. For the first time, now hospital CEOs have the metrics that they can actually measure, and they can understand what the quality is within their radiology services.
And it's a metric that the hospital uses to validate the quality of care that we give. And that is something that I've never experienced in all of the other hospitals that I've worked, whether it's a private practice or an academic center.
Aris has worked with us closely to manage the quality of care received by our patients here and the quality of reads provided by the radiologists. We have experienced a significant improvement in quality under the Aris system.
All reads are done in the United States, and we feel that that's something that's very important in terms of able to manage those radiologists, to manage their quality, and be able to provide the services to the hospitals that we service. And we hold our radiologists to very high standards in terms of being able to deliver that quality.
We're proud of the team of teleradiologists that we've assembled here at Aris. Many of them have completed advanced fellowships in subspecialties, and the majority have gathered years of experience, primarily in the hospital environment.
The Aris radiologists that are working here are way above average to excellent. If I come across a case which is very unusual, or it's a sort of study that I have not seen in a long time, I have the ability to use the resources of the other teleradiologists who have specialized expertise in that particular area. I have multiple subspecialized radiologists at my beck and call, and they're available 24/7.
We spent a fair amount of time analyzing workflow and the rate of cases coming into radiology departments. Whether small hospitals or large hospital environment, those curves are remarkably similar. There are certain peaks during the course of the day that cause backups in the traditional department. Optimizing turnaround time requires a quick response to those surges and peaks, more so than can be accomplished by simply putting more radiologists in the department. We can handle that surge by moving those cases offline, putting them in the network that our off-site radiologists can respond to, and still maintain the turnaround time that everyone's striving to do.
The Operations Support Center dispatches thousands of cases to radiologists across the country. In the event that a radiologist is tied up with a complex case, the Operations Support personnel have the ability to reroute that case to another radiologist to ensure that the turnaround time is met.
Prior to working with Aris, our turnaround times on routine film reads was anywhere between 24 and 72 hours after the examination. Now the turnaround time is averaging 3.7 hours. On emergency film reads, what we call stat reads, our turnaround times are actually averaging 17 minutes. Getting an appropriate read allows the doctors to make decisions quicker and the patients to receive their treatment quicker, and therefore the process moved much more smoothly.
In addition to being the hospital's radiology partner, we also want to be their strategic partner. And we can help the hospitals grow their market share, specifically in imaging, by capturing more volume in the marketplace, and that could come from developing new imaging operations, supporting expansion of imaging operations. We go beyond just providing a clinical radiology service, if you will. We become their business partner in the marketplace.
The beauty of the Aris Hybrid model is we're both on the same side of the desk. We only succeed if we succeed together.
We have been able to attract people who weren't using our system. We've converted some doctors who used to send patients elsewhere for reads to working with us. Aris has worked with us very closely to grow our market. They've helped us fill niches in our service in radiology.
What we help the hospitals do is deliver quality services at a lower cost than the competition.
Our challenge as leaders in the healthcare system are to provide high-quality care at a lower cost. We have optimized the cost of our care working with the Aris Hybrid system such that we have a full range of services. That gives us a bright future.
We're able to put together a team of on-site radiologists supported by the off-site team of radiologists to really address their concerns in the marketplace and put their radiology department in a position to be successful.
When we deploy a hybrid solution in a given facility, we do so for the most part around existing radiologists and the existing resources that are already there. They oftentimes will become Aris employees where they were independent before, and in many cases it's an improvement for them. They prefer that. They don't have to deal with a lot of day-to-day hassles and distractions, billings and collections. They didn't go to school for that. They went to school to learn how to read films. We allow them to do that on a full-time basis.
I have practiced in several different radiology groups and models over the last 25 years, and I truly must admit that working with Aris here has been the most satisfying professional experience of my life. I currently have the greatest professional satisfaction and the least amount of stress that I've ever experienced.
Not all radiology companies are equal. Different teleradiology companies and radiology companies have been formed in different business models. Some are 100% investor-owned, some are owned by radiology practices. Aris is the only radiology services company that has a health system as a major owner. So our commitment to patient care makes us unique.
There are a number of companies that do what we do out there, or attempt to do what we do. I think Aris is unique from our ownership, through our foundation on quality, and the time that we spend in analyzing processes within radiology departments and trying to optimize them. We've built a reputation around the ability to improve efficiencies, to improve workflow, to eliminate redundancies, and in fact allow the radiology department to operate more efficiently than it had previously.
Radiology and teleradiology, while it uses a lot of the latest technologies and fancy data centers and all these types of things, at the end of the day, it's all about patient care.
We can't forget that a patient and sometimes a family is waiting at the other end for the receipt of our diagnosis, and the outcome could affect their lives forever. We try to remember that that could be our parent, our child, and we want to keep that in mind in everything that we do.
Aris Radiology goes far beyond reading x-rays. We want to partner with our hospital clients to not only improve the quality of their radiology reads, but to make a big impact in patient care, independent of if you're a 25-bed critical access hospital or a 500-bed level 1 trauma center. Aris can deliver a service that ensures you get the right read for the right patient every time through our hybrid radiology model.